Well, I'm honored to share these exciting results. So I just want to take you back about cancer immunotherapy treatment for lung cancer. It has changed the treatment landscape for metastatic NSCLC population. They are now recommended to treat fit patients, what we call performance status 0 and 1. And it is important to remember all the pivotal immunotherapy trials alone or in combination with chemotherapy, comparing against standard platinum and double chemotherapy, were performed on PS0 and 1 patients. Median age less than 65, with a range of 62 to 65. The problem we have in our lung cancer population is that we have this big population of NSCLC patients, which we cannot treat with our standard double chemotherapy. So they are predominantly elderly patients with a lot of comorbid problem or multiple medication, or they are elderly with a lot of comorbidity where oncologists felt they cannot offer a standard doublet-based chemotherapy. So this is an understudied population with an unmet need and form part of our daily practice. So essentially, the IPSOS trial is to look at the role of immunotherapy in a randomized setting where they can improve survival. So our primary endpoint for IPSOS is overall survival for the intention to treat population. We recruited 453 patients in a 2-to-1 randomization. So essentially, people who are not fit to have doublet chemotherapy, they are poor performance status 2 or 3, or they are elderly who cannot do a lot of comorbidity and cannot be treated with double chemotherapy. So they get either standard, what I call Atezolizumab, standard dose, or they get a treatment with single agent chemotherapy, gemcitabine or vinorelbine, which has been recommended for PS2 patients. But for PS3 patients, they mainly treated with best supportive care. Primary endpoints I mentioned before, OS, and we met the objective, hazard ratio 0.78, 22% chance of or less dying when you're treated with this atezolizumab treatment. At 1 year time point, survival of 44%, pretty impressive for this poor PS patient, versus 39% for a chemo patient. But more importantly, at the 2-year time point, their survival for atezo patient is 24% compared to 12%. So we're talking about 1 in 4 patients still alive at 2 years when treated with immunotherapy treatment. So just going back to historical data about this doublet chemotherapy, which we developed 20 years ago, which is still used frequently nowadays in combination with immunotherapy treatment. So their survival, 1 year survival for PS0 and 1 patient range from 31% to 36% at 1 year. And compared to what I just seen with our IPSOS study. And they have to stop their recruitment for PS2 patient. This is a 1,200 patient study because PS2 patients just cannot tolerate doublet chemotherapy. Their median survival was 4.1 months. So you have to bring into perspective about this story, about this third generation doublet chemotherapy. We also look at their quality of life. Quite important because these are very symptomatic patients with their cancer, with their comorbid problem or multiple medication, elderly, and mainly confined at home, looked after by their family. And we found over a period of time, atezo patients able to stabilize their function domains, which you can see, which you can hear in my presidential lecture. And they also improve some of the cancer symptoms like chest pain significantly. We saw a hazard ratio of 0.51. We also look at the toxicity issue because you have to be careful when you use immunotherapy to treat elderly patients because they can fall apart. And we did not see that. And so gratifyingly, we did not see any added toxicity when compared to our historical data with patients treated with immunotherapy. Obviously, when we compare to the chemo arm, we see less toxicity. And this is despite a longer duration of treatment with our immunotherapy patient. And so I think on the 3 points, overall survival, response rate, disease control, And more importantly, on quality of life and also on safety issue, we show first-line Atezolizumab improves overall survival compared to single-agent chemotherapy, regardless of their histology, regardless of their performance status, and also irrespective of their PD-L1 expression level, whether it's 0% or more than 50%. Thank you very much.